The province's health sector is preparing for a surge in the number of coronavirus infections, with hospitals receiving more equipment and healthcare workers. Gauteng has recorded nearly 50,000 coronavirus cases, of which around 13,000 have recovered. At least 282 people have died for COVID-19 related illnesses in the province. Masuku was speaking after inspecting the NASREC Isolation and Field Hospital in Johannesburg ahead of the coronavirus peak expected in the coming weeks. Our reporter Hasina Gori has been following the NASREC inspection.
We're in NASREC, south of Johannesburg, at one of the isolation and quarantine centers. Behind us is the red zone. There is where patients who have tested positive for COVID-19 and are unable to self-isolate are then brought here. We know that in the last few days we've seen quite a spike in the number of positive cases in the province, with both the health MEC as well as the Premier saying that the storm is here in Gauteng and numbers are rising quite rapidly. We've seen hospitals being quite congested this week, as well as facilities being burdened during this time. With me to speak more on these facilities and other plans by the health department is the spokesperson for the department, Kwara. Thank you so much for speaking to us. So let's talk about where we are right now. This is one of the isolation and quarantine centers. Just explain to me, what exactly are these facilities, what are they used for, and what's the purpose of having these?
So currently in Gauteng, we have about 4 quarantine isolation centers that have been organized by the Gauteng Department of Health. These facilities are spread out in the various districts in Gauteng. In particular, we have the NASREC Expo Center, which is also one of the quarantine isolation facilities in the Johannesburg district. So this facility has been in operation since about the 15th of June, so it's about 2 weeks plus that it's been operational. We have about 100 plus people that are COVID positive that are currently in isolation here. And additionally, we also have people that are under investigation in a certain section of this area on the other side, which is the quarantine section here at the NASREC Expo Center. These facilities basically are assisting Gauteng members or community members that are unable to quarantine or isolate at home, and they then use these facilities as a way for them to live out their 14-day period.
So we know that we've seen a concern, just not here in Gauteng, but across the country, of hospital beds being an issue, and that field hospitals are being set up. So we do know that this area has a capacity for quite more beds. What will be happening in that instances?
One of the things that the quarantine isolation centers can assist us with, and it's something that we're exploring again, it's around the decongesting of our hospitals. So once we have, positive COVID-19 cases in our hospitals that are stable and can either be discharged or either go home, but alternatively they can come to these isolation centers to, sort of the 14-day period to spend it here. So these facilities can also be used to decongest our hospitals and free up some of the much needed beds. But also the decongesting also involves the assisting with the resource, human resource capacity there. So if you have lesser people that are in hospital, it also assists our healthcare workers.
Government has faced over